the president of Cal State LA. Thank you all for being here today. It's particularly fitting that this state and federal vaccination center is opening here on the campus of Cal State LA, a public university in the heart of Los Angeles. Starting today, it's actually happening right behind me. Communities that are among the hardest hit by the pandemic are coming here to Cal State LA for vaccinations. And this is precisely the role that the university should play during this challenging time, standing with those at the center of the battle against COVID-19, directing our university's resources, our innovation, our energy for the public good, offering real solutions, reliable information, and hope to our communities at a time when they so desperately need it. Opening this site has been a massive undertaking involving great national, state, and local partners. Cal State LA is honored to join with all of the agencies that are represented here, and we extend our special gratitude to the Biden administration and to Governor Newsom. Thank you, Governor, for your leadership and deep commitment to bringing this pandemic to an end. And everyone, welcome to Cal State LA.
Well, good morning. The President's national security strategy for the COVID-19 response and pandemic preparedness is being put to action today. We're committed to ensuring that everyone who wants a vaccine gets one. FEMA has been asked to partnership with CDC in establishing community vaccine center sites, and we're doing that in a number of ways. The first way is we've expedited assistance to all states, territories, and local governments, providing over $3.3 billion to 40 states, territories in the last 21 days. We're also providing federal equipment, supplies, and personnel to a number of sites throughout the country. Here today is the first time that we will actually be putting to work a community vaccine center that's primarily federally supported but state managed. We're doing this today in Oakland and here in Los Angeles. And let me just give a great thanks to CSU LA for partnering with us on this site. The criteria that we've looked at to establish these larger community vaccination centers has been looking at high population areas among the states, but also ensuring that data drives us to the most socially vulnerable using the CDC Social Vulnerability Index, focusing on areas where minorities make up over 40% of the population, looking at other factors such as poverty, lack of housing, or vehicle access. FEMA's deployed civil rights advisors to each state and to each site, along with disability integration specialists to make sure that we look over the whole population. In addition to those factors, we're also looking at census data, and we're also looking to expand this pilot from these two sites here and the site in Oakland to other sites, and we'll be working with Texas and New York next to set up additional sites there. We'll continue to open sites across the country to have large community vaccination centers. In addition to this site here, we'll also have a mobile capability that will go out from this site in kind of a spoke and hub concept to make sure that we're reaching populations most in need. We'll be working with local elected leaders, either faith-based organizations or private nonprofits, to make sure that we are reaching the most socially vulnerable communities. Through this pilot, we'll provide personnel and vaccine above and beyond the state's allocation, which is important. So this will not impact the state's allocation that we're receiving from CDC and the operation each and every week. On that note, there's many other ways that we're looking to quickly vaccinate the American population. Last week, we started a program through the pharmacies to reach through their network, and here in California, they're using CVS and Rite Aid. We provided over 1 million doses last week throughout the United States, and next week it'll be up to 2 million doses. We're also providing support to skilled nursing facilities and healthcare clinics. In addition to that, one of the things that President Biden has done is set what the capability will be looking forward 3 weeks. And each week, since he's come into office, that number has gone up each week. So, and has increased over time, over 57% of when he first came into office. Also, an important note, DHS has, Department of Homeland Security has put out notice that we will not conduct immigration enforcement operations at or near vaccine sites and or healthcare facilities. In closing, just want everyone to know that FEMA is committed to vaccinating everyone. We'll do that in partnership with state and local governments as we are here today. Everyone has a role to support. Families and friends have a role to support vaccinating. Get them registered. You can do that through the state site at myturn.california.gov, or you can phone the 833-422-4255 number for help if you can't use the site. And lastly, please continue to be safe. Wear masks, practice social distancing, and get vaccinated. Thank you.
All right, good morning, everybody. I'm General Glenn Van Herk. I'm the commander of North American Aerospace Defense Command and United States Northern Command, commonly referred to as NORTHCOM and NORAD. Thanks, everybody, for being here. To the governor, to the mayor, state, local leaders, thank you so much for allowing us to be here and being part of this opportunity that we have today. I'd like to say it's an honor, actually, to be part of the nation's first state-led, federally supported vaccination site. I can promise you that the efforts will save lives, American lives, that we're conducting today. My mission as the commander of NORAD in United States Northern Command is to defend North America with my NORAD hat on and defend the United States of America with my NORTHCOM hat on, and also being prepared to provide defense support of civil authorities. Those missions, in my mind, are incredibly noble. What we face today is a threat to the homeland. It may be a little bit of an asymmetric threat called COVID, but there's no more sacred or noble mission than taking care of one's family here in the homeland. And that's what we're actually doing here today, is taking care of folks right here, American lives and saving lives. Secretary of Defense Austin has been very, very clear. The department has capacity and capability to contribute to our homeland's effort to fight COVID. That's exactly what we're doing, and we'll continue providing more, as you heard Acting Administrator Fenton discuss in the coming days. I'd like to tell you that we're incredibly proud of the support that we've provided in just slightly over a year that started with the United States Naval ship, hospital ship, Mercy, right here in this area. That support continued as we took lessons learned and we embedded ourselves in your hospitals right here in Los Angeles and in California. Actually, our effort in Riverside concludes today, where we've had several hundred spread across Los Angeles and also across California and across the rest of the nation. I can tell you that today it starts with COVID vaccination right here behind me. We're here for the long haul. We're incredibly proud of what we've done. We're incredibly proud of what we're doing and what we're going to continue to do in the future to get our nation beyond COVID. Thank you so much for your support. It's my honor to introduce Governor Newsom.
Let me thank each and every one of the distinguished speakers who are about to come up. I want to thank the Mayor in particular for his incredible stewardship and support of not only this effort, but efforts throughout this region. Hilda Solis, President of the LA County Board of Supervisors, an invaluable partner. But in particular, let me just thank let me thank the Biden administration. The Biden administration gets it, and they're getting it done. This is one of 2 sites now here in the state of California operational. Beginning today, as Bob said, with roughly 3,000 vaccines here in Southern California, 3,000 vaccines in Northern California. By the end of the week, we will double that, 6,000 here, 6,000 in Northern California, Alameda County. This is a framework of focus, not just on efficiency, not just speed, but on the issue of equity. That's what brings us here today, not just the spirit, not just the platitude of this being a North Star. This is what this site is all about. It's proximate to a community that has been disproportionately impacted by this pandemic. The effort here is to address that issue forthrightly. We have a responsibility. We have an number of months. In the next number of months, there is the proverbial light. I'll talk about that just briefly. It's a fact, and it's an important fact. 1 month ago today, on January 16th, this state reported 11.4% positivity rate. Today, it's down to 3.5% positivity. 1 month ago today, on January 16th, we reported 40,600 cases of COVID-19. Today, 5,600 cases. 40,600 down to 5,006. 2 weeks, 39% reduction in the number of people hospitalized, 32% reduction in the number of people in our ICUs. We have seen vaccination rate increase. There are only 7 jurisdictions in the world that have administered more doses of the vaccine than the state of California. Some 6.3 million doses of the vaccine has now been administered here in the state of California. We recognize we have more work to do. The issue at the end of the day is supply. We need more Moderna vaccine, more Pfizer vaccine. We need to get the federal approval of the J&J vaccine. We need to provide an ample supply so we can plan not just 2 to 3 weeks out, but over the course of the next few months till we get to the proverbial space we're all looking forward to. Not that long from now, and that's to herd immunity. The good news, parts of the state are already beginning to open back up. Business is already starting to take shape, modified nonetheless. We're working hard to get our kids back in school. It is a priority to get our kids safely back in school, particularly our kindergartners up to 6th grade. We can do that, and we are indeed grateful to the CDC and the guidelines they just put out and the work the Biden administration's helping to advance that cause. I want to just thank all of members of the military, the Air Force, and the Army, our own National Guard, 150 strong, led by General Baldwin, who's here with us, the Office of Emergency Services, led by Mark Ghilarducci, who's here with us, credible partnerships with HHS, our Secretary, Mark Galley, who's here with us as well, working in partnership, hand in hand with local government officials, working with the federal partners to build a logistics operation and an operation that goes where people are. And I think the most important thing you just heard from both the General and Bob Fenton is that this site will have satellite sites. We'll have a mobile unit that goes into the community, meets people where they are. Not everyone can sign up on My Turn. And by the way, if you want to sign up for a vaccination at this site, you can go to My Turn, fill out the application, get notified, and get a date and time schedule. But for those that don't, you can use that 833-422-4255 number, 833-422-4255. We're going to do more and better to reach out to those that aren't even getting that information, don't even have access to a landline. And we're working with community-based organizations, 110 that we've now invested in the last few weeks. We'll be announcing more partnerships, CVOs in Ventura County, in LA County later this week, 150 CVOs strong, focusing on trusted messenger status to make sure that we are in language, culturally competent, bottom up in terms of our frame and our effort, again, focusing not just on speed, but delivering on the promise and promotion of equity. We put out a dashboard showing that we're not where we need to be, African-American community, in terms of the Latino community. We have a special obligation to do more, and that's exactly, again, what this site represents and what the site in Northern California represents. Let me just close, again, expression of gratitude and appreciation, but also I'll close with an expression of expect that the best is yet to come. Now with the dashboard of not only looking more transparency at our provider network, looking at performance, we now have a new third-party agreement that's actually going to pay for performance, that's going to incentivize better performance. That's going to create a contractual obligation so people are getting these doses out of the freezer and into people's arms. It starts here with Pfizer 21 days, we'll get those vaccines in people's arms for the second doses, but we clearly have more work to do to hold our provider network, which, by the way, is roughly 3,500 strong, accountable to actually delivering and getting an efficient, equitably focused effort to get these administration of these vaccines quickly into people's arms. So more work to do in that space, but a lot of good work that's been done that will advance that cause. Final point, none of these vaccines come from the state allocation. None of the vaccines in Alameda County come from the state allocation. This is separate and above. This doesn't impact our pharmacy partnership. Those are separate and above. Or the community clinics where we're investing time and energy and the Biden administration's prioritized. Those are separate and above. We are looking for 1.28 million doses of the vaccine by the end of this week, 1.31 million doses of the vaccine by next week. We're administering, at least as of yesterday, averaging 201,000 doses a day. Do the math. Supply's the issue. That's the constraint. But we are, in closing, building a system like the one the mayor and the supervisors and Councilmember DeLeon and Congressman Gomez and Assemblywoman Carrillo all have been promoting, building out a system whose only constraint is supply. So when the spigot of supply turns back on with J&J and more Moderna, more Pfizer, that we have no limitations in terms of how we've organized the logistics and the network operation, the data and the transparency. So that's what this represents, what Dodger Stadium represents. It's what all of those other large mass sites represent, but also, again, these mobile efforts, meeting people where they are, going into our diverse community. And that's the message we want to deliver today. And we're delivering it because of a new administration, Biden administration, and their demonstrable leadership. And for that, we close as we began by thanking the president for his commitment and his resolve to get these vaccines in the arms of our most vulnerable members of our community. Thank you very much. And with that, let me introduce the president of the LA County Board of Supervisors, extraordinary partner, and someone that's working hand in glove with the 88 cities in her county, and that's President Hilda Solis.